After 3 years of conducting the examination on behalf of the councils, there are certain aspects that we see that can be improved. And we are spending some time having those discussions with the councils and the R&B on ways and decisions that would have to be made to improve those. And we are concentrating on the performance of the exam itself and not necessarily the performance of the student, because the instrument that you use must be able to pull out elicit from the students the kind of behaviors that we are looking for in those candidates. And we want to be very sure that we are measuring the right things and that the students are benefiting, are getting reliable scores out of that process. So today we were discussing how do we link the clinical practice and the clinical exercise with what is being done in the examination. And is it the best way to capture the information just in the examination itself, or to use what is done in the hospitals and the other areas when the nurses are doing their practicum? So how do we get that in, and what process do we use to bring that across? We also look to see how do we share the information that we have now with the colleges and the universities where the nurses are trained. This will then feed back into the process of how they teach and what they focus on, and identify some of the weaknesses that the students may very well have that the examination is showing up. So among those things, we feel that if we can move in a direction to make better links, provide reports with more narrative that persons can follow rather than just statistics, that would also help in better preparing candidates and better assessing to put those people out to practice nursing in the region. I think what would have to happen from here is that the R&B would make recommendations, and then those recommendations would go to COSOG for approval before they can be implemented.